Hi, Dada. Nice to meet you. Yes. Would you mind to introduce yourself to Myanmar patients?
Yeah. Hi. Hello, my name is Dr. Ishita Sen. I head the nuclear medicine department at the Fortis Memorial Research Institute. I'm a nuclear medicine physician, and we look after the PET scans as well as the nuclear medicine therapy, which is done in this hospital.
Yes. Okay. So could you please explain about the differences between PET scan, MRI, and CT scan?
So the PET scan actually detects the changes of cancer or of disease much before they are seen on a CT scan or an MRI, because PET looks at the molecular level of cancer rather than looking at the structural level of cancer, which CT or MRI does. And that is why PET scans now today, PET CT scans are considered to be the standard of care for staging cancer, for assessing response, for looking for recurrence. The reason is the PET scan actually detects the disease way before you actually develop a tumor on a CT or an MRI. And sometimes when the patient has surgery or has radiation and there is some distortion of the normal structure, the PET scan, because it looks at the molecular level of the disease, is actually able to detect the cancer despite the structural changes which a disease can create. So sometimes post-surgery there may be some scarring. So how to differentiate between active cancer and scarring, that is where the PET scan comes in. And there are different kinds of PET scans. So one, you have the regular FDG PET scans, but now there are many advanced forms of PET scans which are specific to a particular disease. And at FMRI, at Fortis, we have access to practically all these kinds of PET scans which are available across the world. So you have a different kind of PET scan for prostate cancer, a different kind of PET scan for breast cancer, a different kind of PET scan for a neuroendocrine tumor. So you have many of these molecular markers which are used for doing these PET scans, which give us a lot of insight about the disease.
So I already know that PET scan at the Fortis Hospital is high technology. Can you explain about this?
Yes, so we have two PET scanners here. One is the time of flight PET scanner from Philips, which was installed almost about 11 years ago. And at that time, it was one of the 8 best machines in the world. And now we have the digital PET CT scanners from Siemens, which is one of the best machines in the world. The advantages of this digital PET scanner is that it is able to pick up disease which is very tiny. So it has got the best in class detection ability to detect the smallest lesion. So the earliest changes of cancer can be picked up on the scan. The second advantage is that it is a very fast machine. So what used to take 20 minutes to do now takes just about 3 to 4 minutes. Okay. And the third, which is very, very important, is that the radiation exposure in this PET CT machine is almost 5 times lower than the other machines. So especially this becomes important in patients who are having repeat examinations. So typically a cancer patient will have one PET scan at the beginning of treatment, one in the middle, one at the end. So each time we have to ensure that the radiation exposure because of the PET scan is as low as possible. So this is where the advantage of this machine is. So while we are able to detect a very high sensitivity of disease, we are also, this is a safer machine because the amount of radiation which the patient is getting exposed to is much less. And also it is a very easy machine. It's an easy investigation for the patient. It is an open gantry. It's a wide gantry, and it's a very fast machine.
Yes. Okay. So could you please tell me what there are any other therapy or the services that nuclear medicine can take care of?
Yes. So nuclear medicine is not just in diagnostics. We are into something called theranostics. Theranostics means that you can look, you can see and treat.
Yes.
Okay, and this becomes very important in many cancers like prostate cancer, neuroendocrine tumors, some childhood cancers, some lymphomas, right? So you have different nuclear medicine therapies which are used for various cancers.
Yes.
And now this nuclear medicine therapy worldwide is one of the fastest growing schemes of medicine, where you can actually give very, very targeted therapy,
Yes.
which actually treats the tumor or disease without damaging the surrounding tissue. And that is why these therapies are called magic bullet therapies, because they just treat the tumor without damaging the rest of the tumor. So this happens in hepatocellular carcinoma, where you have a lot of treatments which are available for patients of HCC. Right? Like tear, which is specific for the tumor. And then beyond tear, now we have some very advanced modes of treatment which only target the tumor in the liver without damaging the rest of the liver. So at FMRI, at Fortis Memorial Research Institute, we have a very vibrant and very active nuclear medicine therapy unit. So we treat, this is a referral center, and we treat a lot of patients with nuclear medicine therapy, especially in liver cancers, in cancers of the neuroendocrine tumors, of prostate cancer, childhood cancers, so a lot of them.
Yes, thank you so much, Doctor. If you have any comments, want to share to them?
So, we would not want you here, because we want that you remain healthy.
Yes.
We want the people of Myanmar to be healthy.
Yes.
We want to you to have access to the best of medical healthcare in your own country. Yes. But if there is anything that you require which is not available, probably Fortis is one destination which will give you access to all these kind of programs under one roof at almost 1/5 the cost of what you would spend in any other country. So the doctors, the kind of technologies which are there are at par with the best in the world. Yes. There are people who come from the United States, who come from Europe to this country, to our institute for availing these treatments, many of which are not even available there. Yes. So we would, if there is anything that we can help you with, we are always ready, not just treating your patients, but also in collaborating with you so that we can improve things at Myanmar itself. Yes. Right? So if there are things which we can give you training, or which we can give you access in Myanmar, yes, happy to do that.
Yes, yes. Thank you so much for your kind sharing. Yes,
thank you.